Hello, this is Sandra Vallejo, and the topic of this PowerPoint is African trypanosomiasis, more specifically Trypanosoma brucei gambiense. The nickname that this disease may also be known by is the African sleeping sickness. Trypanosomiasis is a parasitic disease that occurs in sub-Saharan Africa, and there are two forms of trypanosomiasis. The first form is Trypanosoma brucei gambiense, and this form accounts for 98% of all of the reported cases, and this form also causes chronic infection. The second form is called Trypanosoma brucei rhodesiense, and this form accounts for under 2% of all reported cases, and this form causes acute infection. The reason of there being two forms is most likely a result of the geographical separation due to the Rift Valley that separates parts of Africa. And the amount of cases that have been recorded per year usually range from about 50 to 7,000. And without any kind of treatment, this disease is almost always fatal. The ones who are most exposed and vulnerable to coming in contact with this disease are the ones who live in rural areas. So next is trypanosomes, and the way they travel around inside of the host is with their flagellum that acts as a propeller to help them move throughout the blood and the tissue. The reason they are so successful in spreading the disease throughout the host is by how they've developed a way to bypass the immune system called antigenetic variation. And with this, they have about 1,000 variant surface glycoprotein genes. And when the immune system of the host develops an antibody against the current glycoprotein layer shown, the trypanosome then switches from the expression of the current glycoprotein layer to another one and repeats that process until it has successfully spread throughout the entire body. So next is the tsetse fly, and the tsetse fly is responsible for the transmission process. The only ones that are actually able to transmit the disease are adult tsetse flies, and the process of which the fly gets infected takes about 3 weeks. And the way the fly gets infected is when the fly goes to take a blood meal from an already infected host. It also ingests the trypanosomes as well. And within the fly, the parasite develops into procyclic trypanosomes as well as a result from binary fission. The trypomastigotes then develop into epimastigotes and migrate to the salivary glands. And then once they have finally migrated to the salivary glands, they become metacyclic trypanosomes. And from there, that's how the disease is spread to other hosts through blood meals, and their saliva goes on to the hosts, and that's how the host gets infected. Now, when a human gets infected, there are two stages of TB gambiense. The first stage, which is known as the blood stage, the symptoms include fever, headaches, itchiness, and enlarged lymph nodes. And during this stage, trypanosomes multiply in the subcutaneous tissues as well as the blood and the lymph. And the second stage, which is known as the brain stage, is where it gets its nickname, the African sleeping sickness, as one of the symptoms include abnormal sleep cycles, as well as neurological and psychiatric issues, and in some cases, disruption of cardiac rhythm. The neurological issues that could take place are paralysis, tremors, involuntary movements, and some psychiatric issues that might arise are outbursts, anger, psychotic reactions. And the amount of time that this disease takes to take over the body is about 3 years, and when this disease has progressed that far, death is usually not far behind. Now next is the diagnosis, and the way that TB gambiense is diagnosed is through microscopic examination through the posterior cervical node, and it is substantially way harder to diagnose during the first stage due to its difficulty to detect in the blood, and because of this, it's very rare that TB gambiense is caught before it's already in the second stage. Now, for the treatments, there is no current vaccine to cure this disease, but there are medications that have been known to be used to help with the disease. And the most common medications that have been used are pentamidine, melarsoprol, and eflornithine. And with these drugs, each of them have a set of their own side effects that they come with, but when there's a chance that it can help you overcome the disease, that outweighs the side effects.